Hi, my name is William Jordan. I'm a faculty member at Einstein College of Medicine in Family and Social Medicine. I teach family medicine here at the medical school, and I also work at a community health center near Fordham serving underserved patients. I got interested in healthy food access through a training program that I did in preventive medicine at Mount Sinai back in 2007 to 2009. While I was working in East Harlem, I got to know the local food environment, which is one of the food deserts in New York City. In East Harlem, per capita, there are much fewer places that sell fresh fruits and vegetables, especially compared to the neighboring community of the Upper East Side, which is very wealthy by comparison. What this means in practical terms is there are fewer supermarkets, and it also means that the corner stores or bodegas that most people frequent have fewer fresh fruits and vegetables for sale in East Harlem when compared to the Upper East Side. I got interested in the street vendors who were selling food around the neighborhood. In East Harlem, particularly around 116th Street, there's a large group of Mexican street vendors who sell a variety of products, not all of them healthy. I came to know the executive director of an organization that advocated for street vendors called Esperanza del Barrio through some of the community-based participatory research that one of my colleagues was doing at Mount Sinai. As I got to know the street vendors, I learned that a lot of them were selling food without a permit. They could get a license to sell food on the street, but the number of permits had not been lifted in years, so they frequently got tickets for selling food on the street. And the tickets could be up to $1,000 at a time, and these were vendors who were working on a shoestring budget. So I was interested in the fact that these were people who were working very hard but struggling to make ends meet, and I know that one of the key determinants of health is income, so this was likely adversely impacting their health. And then I also got interested in what they were able to sell. Around this time, there was legislation passing through the New York City Council to expand, finally, the number of permits for street vendors. The idea behind it was that they would expand the permits, but instead of having a general permit where a vendor could sell hot dogs or pretzels or anything they wanted, it would be only for fresh fruits and vegetables and only in underserved areas or food deserts around the city. So I was involved in lobbying for the legislation at the City Council, helped to bring on board a couple of healthcare institutions, including Mount Sinai and Montefiore, that I had connections with. And this involves, contacting the CEO or president of the institution and getting them on board and getting approval from their board of trustees to sign on in support of the legislation. There was a large coalition that was led by the Citizens Committee for Children of New York, and I attended those meetings to help out as I could, given my schedule. The legislation passed, which was great, and these permits hit the street. I continued to be involved with Esperanza del Barrio and went to their meetings every couple weeks in the evening just to learn about the issues that they were dealing with. And when the permits became available, I helped to enroll people in the application process for the permits. A lot of the vendors only spoke Spanish, and initially the permit applications were only in English, so I helped to translate so that they could actually complete the permit applications. As time went on, I realized that although there was seed money from a private foundation to help support the vendors with professional development and other issues, there wasn't as much money going into marketing. So I got a grant first from Google and then eventually from Tisch Illumination Fund to develop what became called Locarto, which is an online map. The idea was to be able to promote vendors where they were with the local community to really help their business get off the ground. We developed a map where the vendors only needed a cell phone, and they could text message in their street corner or the closest street address, and it would move their flag on the map. Anybody out in the community could go on the website and see where the vendor was and how recently they'd updated their location. The other aspect of the map was that somebody in the community could also text message their location, and they would get an answer back with the 3 nearest vendors. The idea behind using text messaging was that a lot of people, especially in poor communities, have access to text messaging, but the penetration of smartphones into the market is still mixed at best. This will probably change over the next few years. But as most people didn't have access to the internet, we wanted to make it accessible from text messaging. And the street vendors, even more so than the community, tend to have limited cell phone capabilities. So over several summers, I had students working with me. They canvassed the entire city and enrolled vendors. They ended up enrolling about 100 and something vendors out of the 200 and something that they encountered over a couple of summers. The vendors have come and gone, unfortunately, so the map has not been as updated as we would like. The margins that the vendors make in terms of selling fruits and vegetables are very small compared to selling hot dogs. So it's genuinely a tough business and not as great of an economic development engine as we had hoped originally. But it also means that vendors may do it for a season and then decide it's not worth it and give up their permit to somebody else. Or they may be employed by the cart owner and they may decide it's not worth it and they turn over, and then their cell phone number turns over, and then we lose them from the map. So that's been an ongoing challenge. We have done promotional activities. Particularly, we have a network of primary care clinics connected to Montefiore, including the one that I see patients at. And our students do food demonstrations in the clinic waiting rooms. So in addition to problems with access to food, people also need to know what to do with healthy food. They may not have grown up with good access to healthy food, and they may not really have seen it prepared and really not know the basics in terms of recipes and things like that. So the food demonstrations that were organized by one of my colleagues, Renee Schenker, really served this purpose in terms of giving people practical ideas that were simple in terms of taking these ingredients. So during the food presentations, we would promote the website so that people could look up and see where the nearest cart was and go and buy the ingredients after the demonstration to make healthy food at home. In addition to access and knowing how to use the food, there are also issues of price. The food may be available, but may be too expensive on a limited budget, and this is especially true for fresh fruits and vegetables, which, as we all know, go bad. They don't last for years like Twinkies or other foods that have a lot of preservatives. So it's a little bit tougher of an investment. The good thing about the green carts is that the produce is very affordable. So it's a comparative advantage. There have been other great programs around the city, such as getting farmers markets into poor neighborhoods that have increased access, but farmers markets tend to be more expensive. The city has tried to address this by programs like Health Bucks, where they distribute vouchers to people living in public housing so that they can get basically a coupon, and it's more affordable to go and shop at farmers markets. And other organizations have tried different solutions. City Harvest, for example, has a distribution point in the South Bronx, and they've recently connected with one of our other clinics, which is called CHCC on 161st Street. It's another primary care community health center, and they have a distribution twice a month at a public housing project down in that area, and food that's collected from around the city that is still fresh but has gone unused for one reason or another is distributed to the community. They connected with that clinic so that the patients, particularly with diabetes, which is associated with poor access to healthy foods, would be able to access that program and get free healthy foods. I don't know, what else should I talk about? Policy stuff or... So a lot of these programs are at the micro level just in terms of getting an idea of how do we get food out on the streets. The broader policy issues include things like advertising. So Nick Freudenberg at Hunter has been a big proponent of looking at how corporate advertising skews what people purchase and how poor communities and communities of color are particularly targeted by advertising for unhealthy foods. So really counteracting that is a challenge. It's hard to restrict advertising because of First Amendment and free speech issues. So providing counter-advertising is something that New York City has been engaging in. You've probably seen ads like pouring on the pounds and that kind of stuff, and you know, you have to walk 3 miles to burn off that soda.